Hi everyone, my name is Alyssa Avila, and today I'm going to be talking to you about gabapentin. And if this is just for the professor, I apologize. I don't know if this is for everybody or just for one person, so I wanted to make sure that I was reading in an appropriate way. So gabapentin. So gabapentin is an anticonvulsant medication that's used to treat epilepsy or nerve pain. And it it basically tells your brain to slow down. It's its molecular buildup is that of um, actual GABA. So if you see the image on this screen, that is the same as gamma. And so it's basically synthetic GABA. Um, so I thought that the best way to do this was to do it off of my own experiences taking this medication. Um, I'm a neurotic person and I don't like taking medication because I feel like it makes me disoriented. It makes me not myself. But unfortunately, I'm prescribed this medication, and so it's messing me up academically. Um, and I don't know why. So I'm actually doing research for that for another class, but since we have to talk about a substance or whatever for this class, I thought why not talk about the medication that I'm on right now. Um, so a year ago I fell. I'm over the age of 30, and this happened about a year ago. I was running in heels and I slipped on laminate flooring and I flew like 6 feet into the air, landed on my hip, my leg twisted, and I slid across my kitchen floor. But I'm a perfectionist and I ended up going to work that day and I worked like 6 hours. And by the time I came home, my foot was 6 times its normal size. And I ended up going to the emergency room, and the doctors there told me that I didn't break anything, but I tore all the ligaments and tendons in my leg. And they prescribed me gabapentin. And so during my recovery, I was taking a 100 milligram gabapentin, which is the smallest dose, 3 times a day, every day. And I had to make sure that I took it at the same time. And I took that medication until I ran out of it. And my doctor told me that I should be feeling better within 6 months. And 6 months had passed and I still wasn't feeling better. And so he said, well, we're just going to have to continue. You're just going to have to continue to take the gabapentin. And I said, why? And he said, because it helps the pain. I said, well, how long am I going to have to take this? And he said, well, if you're going to stay, if you're still in pain, you could be taking it potentially all of your life. And so I was like, is this the only thing that can help me? And he was like, yeah, pretty much. So I was like, all right, well then I guess I'll be taking it. But eventually the pain in my leg stopped and I go hiking now. I'm constantly on the move. You guys will see me in the hallway a lot with the clubs that I'm involved in. I can't stand still. I think it's hereditary. um and so I was doing fine without the medication. I wasn't taking it. I was feeling fine, and so I was like, okay, I'm done with this. Lo and behold, I end up getting the shingles. And I don't know if any of you guys have experienced shingles before, but it is the worst thing I have ever gone through, I've ever experienced in my life. So basically the shingles is like chicken pox that's resurfaced due to stress, and it comes out as these like teeny tiny blisters that pop, and it's disgusting. It's disgusting, and it eventually looks like you have tiny burrows in your back, and the burrows are oozing like fluid, and it's the most painful thing ever. And I ended up going to the doctor because I was like, I can't stand this. I couldn't even, it was to the point where I couldn't even put a shirt on because the texture of the fabric was too much for me on the scars. And I went to the doctor and she prescribed me gabapentin. And I said I was on it already. Are you sure that I need to take this? And she said, yeah, it's to help your nerves. And I was like, yeah, I get that. But I don't want to potentially become addicted. Addiction runs in my family, and I know people that have died from addiction. And I was like, I don't want that to be me. And so she said, okay, well, you're gonna have to take these pills, and then whenever they run out, and she was like, you've experienced gabapentin before, you know what you should be expecting. And I was like, yeah, I guess that's true. But she upped my dosage. So instead of taking 3 100 milligrams a day, I'm taking 2 300 milligrams a day. And it's really affecting my cognition, and it's really affecting like my grades and my self-esteem. And so I don't know, like I said, I just thought it would be really interesting to see why I'm experiencing the things that I'm experiencing, and then use research to back it up. So I'm about to show you guys a video that I found online. My grandparents watched this show. It's called The Doctors. It comes on, like, if you have local television, you probably have seen it before. So they're about to talk to you about the side effects and prescription for gabapentin.
As most folks know, I recently had surgery on my cervical spine. And in addition to being given a prescription for an opiate, a muscle relaxant, I was also prescribed gabapentin. And I took it post-operatively with the mindset that this was just going to allow me to take fewer opiates. And I think it effectively did so. I took as few opiates as possible, and even started to wean off the muscle relaxants, but I stayed on the gabapentin for a few additional days when I went off of it. And maybe that played a role in me then not being able to sleep as well.
Yes.
Okay, have I
great point, because
He
this is
became
what,
a little dependent on
Well,
it, or just tolerant. His body became tolerant to it. I think, listen, you're taking gabapentin and you suddenly stop, you can have a seizure. So you have to taper off the medicine very, very slowly. But, Travis made a great point. He said, it allowed him to not take as many opiates. But what we're seeing in the community is that drug users are realizing that gabapentin potentiates the opiate. It makes the opiate more powerful, and we're seeing it being cut with heroin now. So people are combining these, and they're not realizing how unbelievably dangerous it is.
but I think the numbers are up to support that,
Yeah.
because
Right.
the Ohio Board of Pharmacy, where we know the epidemic for opiates certainly is the strongest, recently reported that in 1 month, gabapentin was prescribed as the #1 drug, and 9 million more prescriptions than oxycodone.
And the withdrawal effects are
mind-boggling.
Yeah, and the withdrawal effects are really severe, and they get tremors, they get sweaty. And then we know that in the last 8 years, actually, there's been a 90% increase in emergency rooms for symptoms related to the off-label use of gabapentin. And I think what's scary is this is really a non-regulated drug. It's not a regulation by the DEA in most states.
And because it's generic, guys, it's very cheap.
Yeah.
It's very cheap.
75 cents on the
75
street.
cents.
It's so cheap.
Wow.
Yeah, so that really affected me in some type of way. So I decided to do some research about it. And I found that it is used to treat seizures and epilepsy. But if you're given the wrong diagnosis, you could potentially have a seizure, which kind of terrified me. It's also used for mood disorders, PTSD, behavioral disorders, insomnia, restless leg syndrome, and drug withdrawal. So basically, gabapentin is a anticonvulsant medication, and these symptoms could be correlated to people experiencing convulsions. And so I thought that was interesting. And chronic pain is also a reason why gabapentin could be prescribed to somebody. So I have nerve damage, and that's why I'm being prescribed it. Some of the side effects of gabapentin are sedation and respiratory depression. So basically, like, I feel really tired and sometimes it's hard for me to breathe. Dizziness and nausea. So I don't really necessarily feel dizzy, but I do kind of feel like tired. And I don't know if anybody's ever been to like the point of like exhaust where you're kind of just like really sleepy. And so like you're not like cognitively there. That's how I feel. And if that's the definition of dizziness, then I guess so. Nausea, yes. I have social anxiety disorder as well, and it's kind of like my anxiety also triggers my stomach, and with the medication it's making me feel nauseous because my stomach hurts a lot more. Insomnia, dependency, and tolerance. So like in the video earlier, the doctor mentioned that he had developed a tolerance to the medication and that he was experiencing insomnia. And in some cases, death, like your heart can literally stop. You could have a stroke or like a seizure and your heart can just give out. That's terrifying. So this video is about symptoms and withdrawal.
I'll tell you, we got a lot of comments from people who have used this drug here, just a few of them. I've had withdrawals from this drug for over a year, and it's been the worst withdrawal I've ever had, far worse than heroin and benzos. For me, gabapentin withdrawals feel like a mix between opiate and benzo withdrawal with a horrible psychedelic twist. It is a nightmare. Another person wrote, I go to 3 different doctors for this med. Doctor shopping, as you called it. I cannot believe my psychiatrist at the addiction clinic is the one who initially prescribed me this. Now I know that it's my own fault for even thinking about whether I could have used this med, but unfortunately, I'm already in too deep. I hope that we've raised awareness for patients, for physicians. Obviously, we need to start thinking at a higher level of controlling the substance. And just be aware, I think this gets back to any individual out there. Anytime a doctor prescribes you medication, just be very clear. Why am I taking this? How long do I need to take it? What is the lowest possible effective dose?
So the people that were mentioned in the video mentioned being addicted to the medication and how they felt on the medication. And so I thought I would discuss that as well. So in order to understand how somebody could be addicted to gabapentin, we need to first define what drug addiction is. According to the Mayo Clinic, addiction is a disease that affects a person's brain and behavior and leads to an inability to control the use of legal or illegal drugs or medication. So in one of the videos that we watched earlier in class, I don't know if you guys used it as a resource, but I did for my review. A few members of the DEA said that one of the things about addiction that is really significant is you don't know you're addicted to something until you're addicted to it. And by then it's too late to help that person because now they're addicted to it. And trying something just once can cause an addiction. And it's terrifying to know that, you know, anybody could be addicted to anything and you don't know if you are unless you are addicted. Gabapentin enhances the effects of other drugs. So like the video said earlier, it potentiates the effects of the drug, which basically means that it makes it more potent. And it makes it stronger on the body. So for example, if a person is a heroin addict and they're addicted to that euphoric feeling, they want to feel that all the time, and they end up taking gabapentin, that gabapentin is going to enhance the feelings of the heroin. And then that could cause the person to become more tolerant of that combination, and then they're adding more drugs into their system, and then, you know, slowly increasing their addiction. And withdrawal is a nightmare. So I'm actually trying to lower my dosage. I'm having a lot of trouble in class, and I wasn't in class for 2 weeks, and so because of the shingles, I'm a little behind, and I was behind earlier because of the pain I was in, but now I'm behind because I feel like the gabapentin has been affecting me cognitively, and I think that my professors are expecting more, and I can't really give them that right now because I'm going through some stuff. And so I'm trying to wean off of the medication. But I've been experiencing some weird side effects, and I thought it was just stress. But come to find out, it's symptoms that are similar to this research that I found. So the feelings of withdrawal would begin after 2 or 3 days of not taking the medication. Facts. Like, I stopped taking it for 2 days, and I ended up getting really bad anxiety. I'm sweaty a lot, and I just feel really annoyed. One of the people in the video said that the withdrawal symptoms are worse than a combination of benzos and heroin. And in this article that I read, it's the same article. They said that the withdrawal effects are similar to that of benzos. And I'm not the type of person to experiment with drugs, but I would not choose to feel this way, and I would not want anybody to feel this way. I'm not saying that being an addict is a choice. It's definitely not. But I hate that I'm being prescribed a medication that has such controversy. And the more research I do, the more I'm kind of like, oh geez, like it's gonna be really hard to reach a state of homeostasis after this. And so in the article, it said that the symptoms that a person can go through when experiencing withdrawal are irritability, agitation, anxiety, irregular heartbeat, cold sweats, confusion, disorientation, neurological behavior malfunctions, and convulsions. So like I said earlier, if you are misdiagnosing, it can actually cause you to have seizures. So in conclusion, I just wanted to summarize what I discussed. We talked about what gabapentin is. It's an anticonvulsant medication that's used for nerve pain and epilepsy, and it slows down your brain. It's basically synthetic GABA. Why is the drug prescribed? Again, nerve pain, to help mediate the symptoms of withdrawal, anxiety. Gabapentin, in my opinion, is prescribed basically like ibuprofen, but to be honest with you, it has way worse side effects than ibuprofen does for me. This is just my perspective. What are the side effects? Dizziness, a sense of slowness, like it's basically like the world slowing down a little bit. Pain relief, you know, the shingles has like gone away, and I don't feel the pain that I was feeling earlier. However, like a lot of people who are prescribed medication, I am taking it really easy on with stopping my medication dosage because of the side effects. You know, like I mentioned earlier, if you're taking the wrong diagnosis, it could be worse for you than when you originally got on the medication. And is there a chance of addiction? Yes, but there's a chance of addiction for anything, really. So yeah, these are my resources, and that's it. Thank you for listening to my TED Talk.